I'm a professor of cardiology at the Ankara University Medical School for for 45 years now, after becoming a medical doctor. I worked at Ankara University Medical School, Department of Cardiology, and still I'm there. And I like cardiology. I became a cardiologist because of one of my mentors, who was cardiology professor of cardiology at that time when I was doing my internship. So I liked cardiology and his behavior to the patients. So that's why I became cardiologist. Well, the 5 guidelines have been launched, you know, and the session for the guidelines was really excellent, and especially I'm fascinated with the findings or the recommendations of the new diabetic drugs for the cardiovascular patients. That's the most important thing, I think, in this Congress. We have now 2 groups of anti-diabetic drugs which will give the results, positive results for the cardiovascular patients. So it's really a good development and a new development for this area, for the patients diabetics with cardiovascular disease. Well, I'm a fellow of the ESC as well. For the beginning, maybe 25 or 30 years, I've been attending all the ESC meetings, and once upon a time I was the member of the board as well. I spent a lot of years in the associations, in the board of associations, also nominating committee, and everywhere. So I'm very well involved in the ESC, and it's the only one and the best congress in the world. It's increasing the number of participants, attendees as well, and it's number 1, and I like it very much. Wonderful meeting, top 1. So it's good to be a member of the ESC as well. I was taught as an echocardiographer in 1981 in London at St. Thomas's Hospital. So I'm principally echocardiographer. Then I became associate professor and I became invasive cardiologist at that time. So I do both, but not the last years, of course. I'm doing administrative things in the last 5 or 10 years. So I know echo very well, and it began with M-mode echocardiography, and now it's 3-dimensional time. So the development in echocardiography is huge and it's magnificent, and at the end I think we will do everything with the non-invasive methods. With the CT and MRI, I think we will solve all the problems in cardiology. Yeah. Well, as I mentioned last year as well, Turkey is doing a lot of things for preventive cardiology, and the Turkish Society of Cardiology and the related societies are very well have very well relationship with the Ministry of Health in Turkey, and Ministry of Health is doing good things, especially on about, let's say, smoking and obesity, and it pushes the people to do more exercises, and we had campaigns against the blood pressure diabetes, obesity every year, and the Ministry of Health is supporting all these campaigns in Turkey. Once upon a time, we were selected by ESC as the model of the preventive cardiology in Europe, and we had a special session at that time. So we are trying a lot, but it's difficult, of course. Well, the coronary artery disease is still the most important problem in Turkey, but we are doing a lot of things, and especially in invasive area. Stenting and the ambulance system is very good, and we did a lot of things for the patients who had acute MI, and the system is very effective with the help of the Ministry of Health. And but as I said before, I mean, you have to push the people to have checked their risk factors, especially smoking, obesity, hypertension, and the blood sugar. Well, I'm very happy being a cardiologist. I always wanted to be a cardiologist, and again, if I come to the earth again after that, I want to be a cardiologist again, because I mean, you do a lot for the patients, either medically or invasively, and you have good results with the patients. So you are satisfied, and all the patients are satisfied. So that's the most important thing for me and for the patients, of course. Satisfaction.